So glad we are back for another episode in Mastering Counseling. Today, we are very privileged to have Dr. Michael McGee in California, who is a distinguished psychiatrist with over 3 decades of experience, who has focused on blending spiritual insights and especially helping people with trauma and addiction psychiatry. Thank you so much for being here today.
My pleasure.
Why don't you go ahead and tell us, Dr. McGee, how did you begin integrating spirituality with psychiatry? How did that process evolve over the years? And if you need to go back to the beginning of your career, that is fine too. We love hearing the history of how your profession has developed.
Sure. It started with my first a job out of residency, which was on a unit treating patients with alcohol use disorder and other addictions, and learning about the 12-step recovery model, which is still, the most effective model for recovery from addiction. And that is a spirituality-based program. And so in learning about the 12 steps and the integration of spirituality into recovery, I got very, very interested in the role of spirituality. And then over the years, learning about mindfulness and heart-mind practices and the work of Kristen Neff on compassion and other principles of Buddhist psychology that have now been integrated into the mainstream of mental health practice. It really has been super interesting to see the impact of that on people's healing and recovery. Programs like dialect or treatment methods like dialectical behavioral therapy, which has a strong mindfulness-based component. So that's sort of, and then also my own personal meditation practice. I don't have a particular religion, but I find that these kind of mindfulness and heart-mind practices are just very, very beneficial for leading a wise and loving life.
All right, thank you. Very interesting on that for sure. And yeah, we have seen so many more practices everywhere involving the whole person for sure. So we see that in schools as well. Can you talk to us about some of these patient outcomes, particularly with addiction or trauma recovery? What are some of the ways that you have been able to help these people who are struggling so deeply?
Sure. Well, in terms of spirituality in particular, there's a limited literature, but there is a signal in the literature that shows that people who have had spiritual awakening type experiences may have as much as 2 to 3 to even 4 times higher rates of recovery than people who haven't had spiritual awakening experiences. So it's a super interesting kind of cutting edge area of research of how to facilitate spiritual awakening experiences to promote recovery outcomes. And we see that in some of the research with psilocybin, for example, and people having mystical experiences leading to just profound, incredible outcomes, for example, for tobacco use disorder and alcohol use disorder. So super, super interesting, cutting edge stuff that's going on. And in terms of what we think about the awakening experience is that the experience of oneness or unity creates a sense of profound reverence and a sense of awe and wonder and a profound sense of wanting to live, to benefit oneself and others. Some might call that love, right? And so that sense of unity can be simply simplified to a sense of love, and then sort of a transition of motivation or intent and to the way one lives one's life from, let's say, just trying to stay shut off and dependent and avoiding one's pain and figuring and trying to manage one's pain to moving to living life from a place of wholeness and living to benefit oneself and others. There's a profound transformation of agenda that can lead to sort of downstream changes in behavior in terms of being more open to connection and to loving and being loved and to taking care of oneself. So these kinds of awakening experiences can just be profoundly transformative. And so how we go about nurturing and cultivating those experiences in our clinical work in a responsible and evidence-based way, I think is a great and exciting challenge. Now, apart from that, I think that optimizing outcomes for recovery from any kind of illness really involves sort of a holistic biopsychosocial spiritual approach. And so I think you need to really look at the recovery environment that people are in, their support, their structure, the stresses they're dealing with, uh, giving them a supportive relationship where they feel seen safely and apprised and affirmed and understood, undoing isolation and aloneness, psychopharmacological interventions for opiate use disorder, for example, with medications like buprenorphine and naltrexone are a mainstay of treatment of substance use disorders for opiate use disorder in particular, but even for alcohol use disorder. So this really comprehensive, holistic approach is really important for optimizing outcomes.
Thank you. Such good detail there and kind of pulling it together for us. And a lot of things that, when you're even involved in this field, if you're not particularly working with addictions or trauma recovery, things that people may not have studied yet, or it might open up a window for those who are wanting to go into this type of work, and understanding what they'd be learning about and understanding the human body and brain. So thank you for that. Can you talk to us a little bit about, at this point, your practice? And I think we may get into this a little bit more later as well, but it seems like you are still working with patients and have your own practice, but then you are also coaching up and advising and speaking to other clinicians. Can you talk about how that works? Is it within your practice? Is it all over the state or the country? How does your network look?
Yeah, sure. So thank you. So yeah, my practice is moving more now towards training and mentoring and nurturing other clinicians. And I have a national podcast on medcentral.com called Be Well, Practice Well. And basically, I'm super interested in the integration of clinician vitality with clinician skill. And I see an interplay and interaction between the two, between vitality and skill. And one thing that has really become clear to me is that most clinicians who go into, not most, but many, maybe most, but many clinicians who go into our field have their own history of trauma. And we know that in the general population, about 60% of people have had at least one adverse childhood experience. And from another perspective, in terms of little t trauma, we live in a somewhat toxic and traumatizing culture, all of us, in many different ways. So, as clinicians, we are all dealing with some degree of trauma, and it can be quite significant, or it can just be what you might call everyday trauma. And so that affects our capacity as clinicians, and it informs our capacity as clinicians. And so I think one of the most important things that we can do to be good clinicians is to attend to our own vitality, including our own trauma. And there are just so many aspects of that, right? So our own self-care, and working in stressful systems, healthcare systems, and then developing our clinical skills in the context of vitality and wholeness is really, really super important. And for that, I've been doing more and more coaching on both individually, but I also speak at a number of different conferences and to different programs, and do a lot of training on how to provide a skillful treatment. And my focus really is on person-centered care, and really accountable care that is really focusing on developing both the therapeutic alliance and developing sort of a buy-in and a therapeutic allegiance, and agree about what work we're going to do together, and also coaching on motivational interviewing type skills. In other words, how to help people change and grow. As part of that work, I not only do this personally, but I also do coaching on what's called feedback informed treatment. And this is the work of Scott Miller and Bruce Wampold and others, and really, really moving towards measurement-based care, and moving, for example, towards really not only getting satisfaction and outcome results with all of your patients, but perhaps even interviewing or videotaping your sessions with your patients. I'm doing that now. And then finding coaches or other people who can review your work with you and go over it and give you feedback. I really believe that one of the core paradigms for excellence is the work of Anders Ericsson, and others who have developed these models of deliberate practice, where you basically get feedback, from your patients, you videotape your work with a coach, review your work, and then identify areas for improvement of your clinical skills. Maybe it's providing accurate empathy, for example, and then deliberately practicing those clinical skills in an iterative, over and over way to hone those skills intentionally over time. So, I think that combination of practicing skills, developing those skills, and then really intentionally attending to nurturing our own vitality and addressing our own healing. That's kind of, again, sort of the holistic way that I'm approaching training.
Thank you. When I was looking at your website, two words did stand out to me: love for sure, and everyone's approach, and then the word vitality. I really like that. A lot of people are saying self-care or recovery, but the word vitality, I really like that, and speaks personally to me too. When you talked about most people having some type of adverse childhood experience, there is also the day-to-day, the things we're seeing in schools or that therapists, the stories that you hear, they affect you greatly and affect sleep and just your stress level. So I hear that. I'm on about day 9 of my break from school. So yeah, right now I'm feeling pretty good, but it's always looming in the back of your head for sure. So thank you for taking all the things you've learned and trying to help out the younger, newer clinicians. Can you talk about some very specific ways that you help clinicians to balance their personal and professional life? Do you give a lot of personal suggestions? Do you help them with scheduling? Do you advise on how many clients they should take? What are some really specific ways that you help clinicians in that way?
Mhm. Yeah, so that's a really good question. I'm really interested. Well, there's sort of the superficial level of looking at what is the optimal balance of work, love, and play, and self-care. Those four dimensions for every different person, and it's different for everybody, right? And so everybody has to find that optimal balance for them, right? So that's really super important, and part of that involves the skill of being able to say no, and
Mm-hmm.
and the ability to set prioritize and to schedule your priorities and all that kind of stuff, and developing of healthy habits. And so there's all that cognitive behavioral, organizational stuff that we all have to do, hopefully in the context of support and accountability and structure and routines and blah 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 blah. So,
Mm-hmm.
and that's all pretty much well known. But I think that stuff is very, very difficult to do. And my approach is actually to go a little bit deeper than that and look at the underlying dynamic issues that are sometimes driving people to self-neglect, to internal
Mm-hmm.
stress, and um, to burn out, and to living a life where they're not getting their needs met in a way that's balanced, that's right for them.
Mm-hmm.
And so those deeper issues really have to do with what I call, I mean, there's different words for this. In my approach, I call this appreciative attending, where you're attending with inquiry and non-judgmental appreciation of what you find within yourself.
Mm-hmm.
And I know Governmente talks about compassionate inquiry. I think it's the same thing. But really looking within in a very careful, open, and honest way, and hopefully doing that with a mentor or a therapist, uh, or good friends, because I don't think anybody can really truly do this work alone. And then looking at what you see within. So, for example, a refinement of intention. A lot of times people get burned out and are living a life which is harmful to them and not balanced because maybe they feel like they need to please other people. Maybe there's
Mm-hmm.
fear. Maybe there's a sense of inadequacy, or maybe there's a sense of a need for more money, or more achievement, or more recognition, or more status, or
Mm-hmm.
um, these things can be very, very subtle, right?
Mm-hmm.
And so I really think that part of the practice of maintaining our balance and vitality is sort of a grounding ourselves in our goodness and a refinement of intent. And that is an ongoing, day-to-day, meditative, lifetime practice. And
Mm-hmm.
and so a lot of my coaching and work with people is around looking very deeply and honestly at those issues. And I don't see a lot of that actually in the kind of burnout wellness literature. I mean, a lot of people have written about these issues, and there's a lot there. There's a lot that can be done on its systemic and organizational ways in terms of saying no and asserting yourself, and
Mm-hmm.
even lobbying to address, for example, toxic corporate interests that are harming you in your workplace. So all of that is fine and good, but I'm super interested, uh, in the way that we process what's happening to us, right, and then
Mm-hmm.
respond to it, ourselves. I think that that comes out of um, uh, just so much of our wellness and vitality is not so much what happens to us, but the way that we process it and then respond to it. So I think that that both internal and external orientation to managing wellness is important.
Yes, thank you. Definitely, for sure. Everyone has different thresholds of how much they can handle, and depends sometimes on seasons of life and even seasons of the year. And yeah, I hear that for sure. You mentioned some different authors and some of the ways that you're working with clinicians, but what are some specific books? I believe you've written at least one book or online courses that you find most impactful, or you find yourself sharing the most with future therapists and psychiatrists and counselors?
Sure. Okay. Um, I think uh, I'm I I am actually right now super interested and have been really enjoying the work of Gabor Mate. His book, The Myth of Normal, I've really enjoyed.
Mhm.
And I'm actually working on another book which actually extends deeper some of the principles he's articulated called Heal the Hurt. And I hope to have that out next year. But
Mhm.
basically, I think his work is good. I think the work of Tara Brach is very good on integrating mindfulness into healing. Um, Let me think. Those have been two really important influences for me. I think from a larger um, sort of systemic book, a really great book out there is called Healing by Thomas Insel. And that gives a more sociocultural, psychosocial um, look at our larger systemic issues. I mean, the work, we can all make an impact on mental health at various different levels,
Mhm.
both in our individual work, but also on larger sociocultural levels. So that book, Healing, has been a big influence on me. Um, I've written two books on recovery from addiction. One is called The Joy of Recovery, and then another one's called 101 Things to Know If You're Addicted to Painkillers. Um, and I have
Mhm.
an online course on my website on basically uh, this developing our capacity to love and be loved, basically to benefit ourselves and others. And it's sort of a skills-based approach, like developing, for
Mhm.
example, the capacity for empathy or for assertiveness or for collaboration or for forgiveness, or for practicing gratitude with others. I really think that if you haven't learned how to love and be loved, I'm very, very interested in the idea and devoted to the idea that we can develop our capacity to love through intentional, dedicated, daily, gentle practices.
Mhm.
Anything in those realms, I think, are really, really helpful. You know, I'm super interested in what's evolving in the field of psychedelic psychotherapy, but it's all
Mhm.
very tentative and very initial, and I'm very, very concerned about the exploding kind of craze and fad about it, and everybody, doing it underground and unmonitored and those kinds of things. So I'm kind of cautiously optimistic and hopeful about it, but also very alarmed uh, about what's going on right now, and about the potential harm from the indiscriminate use of these agents.
Okay,
I'm
interesting.
I'm
Can you
also
talk a little more about that specifically? What are you
yeah.
speaking to?
Yeah, sure. And then I'll mention one other thing to you that has had a huge impact on me. Um, right now there's this sort of mushrooming of ketamine clinics and anesthesiologists and others giving ketamine without with very little evidence base so far. I mean, there is some evidence base, but and I think there's hope and promise, but it really concerns me, the way this is happening, with the risk of addiction and cystitis um, and people using these medications that in a way that is not paired with very skillful integration at work and risks of harm to patients, and underground psychedelic use. And there's a lot of states like Colorado and Oregon that are on a collision course with the DEA and the FDA around the approval of the use of psychedelics that are still Schedule I drugs. And so even though, I'm really interested from a research point of view and clinical point of view in cultivating awakening and the potential for psychedelics for that, I really think that I think we're maybe 5 or more years off from figuring out how to use them in a safe and responsible way. One other resource I'm going to mention to you, that I think is a great, that any counselor should really, really, really look into, is AEDP, or Accelerated Experiential Dynamic Psychotherapy. And this was developed first about 20 years ago by Diana Fosha, Fosha. And it's what we would call a fourth wave therapy. And it is, I think, the future of counseling and therapy. And the reason why I say that, and there's a book that I would recommend people read called Undoing Aloneness and the Transformation of Suffering into Flourishing, AEDP 2.0, edited by Diana Fosha. And I think this book is just a game changer and is going to transform our field. And I do see a great potential for integrating AEDP potentially safely and legally with psychedelics in the future, for profound transformations and healing of interpersonal wounds and trauma. The thing about AEDP is it's really an intensely interpersonal approach that really leverages a very direct, honest, warm, transparent relationship of knowing and being known, seeing and being seen, being understood, being cared for, being held in the relationship. But then also what's called metatherapeutic processing, where you actually then above that begin to talk about the what it's like to have that experience with the therapist, and then to process, to get to very painful core emotions like hurt and anger and sadness and grief, and process those emotions to completion, and then be left in a state of what's called transformance, where you then sort of feel the sense of hope and a sense of knowing the truth of what happened to you and of where you're at, and maybe tapping into a core feeling of wholeness, and then metatherapeutically processing what is it like to have that experience with another human being who knows and understands and cares for you. And that leads to what they call in the ADB language sort of a transformance spiral of growth. And I first kind of learned about this from a colleague, Mark Green. And there's a great book on the healing of complex PTSD that I also really moved me, by Stephanie Fu, called What My Bones Know. And that book, she worked with a person who I think does AEDP like work. His name is Johnny Ham, and I think he's he's the head of a trauma recovery program in New York. His work and the way that Stephanie Fu talks about her therapy with him is just brilliant. And I would really recommend that for any therapists who are really want to see what healing from severe trauma looks like in these emerging therapies. So that's kind of what has been a big influence on me. The other thing I'll mention to you that is having another influence on me right now is I'm studying the work of David Cooperrider on appreciative inquiry, which was first developed at the Cleveland Clinic in the 1970s. And there's a whole field now that's evolving over the past 50 years on appreciative inquiry. And your listeners can read about it more at the Center for Appreciative-Inquiry.net. But Dr. Cooperrider's work and others over the past 50 years have really evolved this beautiful way of both personal and organizational development that's based on a fundamental paradigm of really doing a careful appreciative inquiry or inquiry into with appreciation of what's good and right about our life, about our situation, about our society, about ourselves, about our relationships. And rather than taking sort of a problem-oriented approach, really moving to an appreciation or a strength-based approach, and then growing and healing based on an appreciation. So, for example, with our New Year's resolutions, appreciative inquiry approach, rather than saying, I want to lose 30 pounds or making a resolution, which almost never works, an appreciative inquiry approach would be to say, what do I want to make as an intention? And the intention might be, I want to nurture my relationships with my spouse and my friends, for example, as an intention. And that comes from a positive intent rather than a problem-solving resolution. I'm going to do this to fix this kind of approach. So it's a fundamental paradigm change that I think the field of psychiatry and therapy and psychology and counseling really, really needs to a strengths-based, resilience-based approach rather than looking at what's wrong with people. So that's kind of a background of where my head is at with who knows where I'll be in a year from now, but right now that's what's on my mind.
No, thank you. That's a wealth of so many books and websites, and I love that you're sharing what you're processing as well, because we know we're always learning new things, right? Even though you're probably more of an expert than most, you're still reading, studying, considering, and have probably, the cool thing is you saw these studies begin in the 70s and 80s, and now you're looking at where we are as a culture. So very interesting. One thing that stood out to me was just in going deep into when people have trauma, a big thing we've been talking about in our school and district this year is sometimes the kids, they don't even remember the trauma. They can't place it or speak about it, but their body remembers. And, it's usually a sad situation, but it is so interesting to me how the biological response to some type of trigger experience and then is brought out in so many different ways. And then it's hard for the adults to understand what is happening, but these types of studies and things help for sure. So, well, you've given us so much information. Sorry about that. So much information and lots of good words and terms to consider and read up on more about. Is there anything else that you want to share with people who are considering going into this field or maybe in the middle of their program?
Yeah, I would, I would say this work is a calling. I think it should be a calling, and to do this work, we need the support of others to process our experience and make ourselves whole. I think every counselor and therapist should be in therapy themselves. I'm a strong believer in mentoring, having a coach, feedback-informed treatment, getting satisfaction, tracking satisfaction outcomes, videotaping your sessions, deliberate practice of specific clinical skills, especially motivational interviewing skills, and that should be a regular part. If you really want to be an excellent clinician, you have to have dedicated practice with iteration and supervision. And to do that, you have to be okay with getting feedback and be grounded in your goodness and be okay with being imperfect. And that requires some humility. And I think it requires the practice of healthy professional doubt, and always maintaining that and relentlessly, eagerly seeking feedback on your work. So that's sort of a summary of what I would recommend for anybody going into this field.
Good things for sure. We all want to be growing, and sometimes people take so much offense to feedback that they don't like, but I completely agree. It's the only way to get better for sure. So thank you so much for being here on this right before New Year's, and just for there's so many things you could teach us about. Thank you for giving us a good overview and a lot of things that we can read and study. So I appreciate you being here today, Mike.
Okay, good to be with you. Happy New Year.
Thank you. To our listeners, thank you so much for interacting and listening on Mastering Counseling. Please leave us questions about new things you want to talk about. Leave us comments on Instagram, Facebook, and continue to listen for future enlightening episodes. Have a wonderful day.